It's a lifeline for our patients. Contrary to popular opinion, not all LGBTQ folks are affluent. LGBTQ folks are more likely than our non-LGBTQ counterparts to be living in poverty. And community health centers like Callan Lord nationally care for, on average, 1 in 6 Medicaid beneficiaries. Medicaid, as Charles mentioned, is a lifeline for care for more than 42% of people living with HIV. And even at Callan Lord, 28% of our patients are on Medicaid, and an additional 26% are still uninsured, even with the Affordable Care Act. So we know that we cannot afford to get rid of or roll back or dismantle Medicaid. We know this is true for the young queer person who wants to get an STI test off a mobile van, for the young person who wants to access pre-exposure prophylaxis, which is the once-a-day pill to prevent HIV, for the older queer woman or lesbian woman who wants basic primary care or GYN care. We know we need Medicaid to fortify these services and to keep our communities healthy. Sometimes I feel like we're fighting for our lives. We are fighting for our lives, and we shouldn't have to fight. We should be living our lives healthfully, freely, peacefully, hopefully. And for that reason, Callan Lord will remain standing strong against this bill and any other bill, for that matter, that dismantles Medicaid and takes away the health care for our people. Thank you very much.
Thank you. From the beginning of our epidemic, our stories have been one of our most powerful tools. And our next speaker is someone that I'm very proud to introduce because they just agreed to speak in the last few hours. She gave us her testimony at a meeting that we were having this morning, and we remembered not only that our stories are powerful, but that we needed to meaningfully and thoughtfully include the voices of those who are living with HIV at every opportunity possible. So our next speaker, Masonia Traylor, is from Atlanta, is catching a flight in the next few hours home, but is taking time to speak to us here today. She is a member of the Positive Women's Network, and I would love to have her join
me. Thank you. So my name is Masonia Traylor, and I was diagnosed HIV positive 6 years ago, nearly 7 years ago, at the tender age of 23. 2 weeks after my diagnosis, I found out I was pregnant. During that year of 2010, I was dropped from my mother's health insurance despite being a college student because I had aged out of health insurance. During that time, I did not know that I was HIV positive, but once I got tested, it came back positive. 4 years before that, my HIV test remained negative, although I was in a committed relationship. However, I did not know much about Medicaid or government assistance. When I applied, I had Medicaid, and then I was diagnosed with HIV. I can only imagine what my life would have been like had I not had Medicaid. Having Medicaid allowed my daughter to be born HIV negative in 2011. When health insurance was extended for young people to age 26, that allowed me to be back on my mother's insurance. However, because I was working as a pharmacy technician and not making more than $9.50 an hour, I was not bringing home more than $1,000 a month. As a mother of two, that's really not enough to cover even the basic necessities, including food. I needed a bachelor's degree in order to even get a salary pay in order to have access to health insurance. However, I was working in healthcare as a certified pharmacy technician, licensed pharmacy technician. I was counting HIV medications for other people living with HIV. However, my job would not provide me the opportunity to have access to healthcare and make enough money to be able to pay for that same healthcare. That is the definition of insanity. Going to work every day, requesting to have a full-time position, during the daytime so that I may be at home in the evenings and the weekends with my children was not extended to me. I requested to have higher pay or just more hours, and it was still denied to me. If it was not for having access to Medicaid, I would not be standing before you today. Without Medicaid, my medications are, I only take one medication. That one medication costs about $3,000 a month. $3,000 a month. It's only 30 pills in that bottle. That's without health insurance. If I make over $400 a month, I will be dropped from Medicaid today. If I make over $400 a month, that means if I make $400.50, that 50 cents will disqualify me from Medicaid today, and I would have to find other programs or opportunities to find ways to be able to have access to my health care. Not only do I have HIV, but I also have been recently diagnosed with fibroids. That was only a month ago. So HIV may be at the top of my list. However, I have other health issues. I have hyperthyroidism that I've had to battle with that is now under control. I do not want to stay on Medicaid. I look forward to finishing college and having that bachelor's degree so that I can apply for a better job that will allow me the opportunities to pay for and contribute back to society. I use Medicaid as a stepping stool for myself to be able to continue living with HIV. Not saying that 30 years ago I would have been amongst those thousands, hundreds of thousands individuals, but you'll be bringing it back today. Understanding our history and moving forward means allowing someone like me to have access to health care without all of these strenuous processes, without having to think about if I decide to have another child, that child may possibly be born with an HIV diagnosis simply because I did not have access to my HIV medications. This bill does not help me. It does not help many others like me, those who do not work in healthcare profession, but do need that same type of access, that it does not help them as well. Most people who are impoverished do not want to stay impoverished. These are tools for us. These are not things that we're just taking advantage of, sitting on our tails, not doing anything. There are so many people who are working class individuals, okay? Working class individuals that qualify for government assistance. I think that is absurd that we are working. I am a pharmacy technician in need of my medication and access to proper health care and health insurance. That does not make sense. 2 + 2 = 4, not 3, and this is not adding up at all. With that being said, I want to leave you guys with this note. Respect yourself, check yourself, and protect yourself because no one else can do that for you. Today is National HIV Testing Day. Make sure you know your status. If you do, make sure that you do everything you need to do to fight to make sure you stay alive and not pass this virus on to someone else. Thank you.
Thank you so much. Next up, we have Dr. John Carlo from Prism Health North Texas in Dallas.
Well, I am deeply humbled to be standing here among this great group of people who are here doing their part to make a difference in this community. My name is John Carlo. I'm from Dallas, Texas. I have the pleasure of leading an organization that has been on the ground for 30 years combating this epidemic. And what I can tell you from the ground today is we are looking over to the edge of a cliff. It's over a cliff because the mountain has grown so high thanks to the amazing amount of innovation and care that we now can deliver, that we can talk about HIV being survivable, livable, and normal in terms of a lifespan. But this cliff that we look over now, this edge, worries me because I believe that this bill will make us even more at risk to fall off the edge of this cliff. I want to talk about one particular group of people that I know this will impact the most. Those that have worked hard, that have an income, whereas before the Affordable Care Act did not allow them to have insurance. We eliminated that. We have eliminated the pre-existing conditions. We allowed for an insurance that was affordable with the exchange. When you look at this bill, there's things like actuarial value that's in this. There's things about removing cost sharing and cost savings assistance. What that's going to do to our patients is this. Whereas now it's tough. It's tough to fill those expensive prescriptions. They make decisions on the day-to-day on how to judge that. When you move from that level to a level that's being professed in this bill, it becomes unaffordable. And that is wrong. I think that is absolutely wrong. We should not be determining who has access to health care based on how much is in the wallet. Again, this is the time. I really am proud to be here. I think this is an amazing group of people, and I think together we can make a difference. Thank you.
And next up, we have Karen Pearl from God's Love We Deliver in New York.
Good afternoon, everybody. I am Karen Pearl from God's Love We Deliver. For 32 years, we've been providing food and nutrition services to people living with HIV and AIDS. I also lead the National Food is Medicine Coalition, where we work to have food and nutrition services integrated into healthcare delivery. And why do we do this? We do this because we know that social determinants of health matter, that people who have access to services like food and nutrition just do better. They have better health outcomes. They use the hospital less often. They don't go to the emergency room. If they do go to the hospital, they stay less long. And when they're discharged, they go home where they want to be, not to an expensive institution like a nursing home or a rehab facility. So all the research shows that social determinants of health, I'm most familiar with food, but also housing and transportation and legal services, and all of them really make a difference in the lives of people living with HIV and AIDS and all other severe and chronic illnesses like cardiovascular disease, advanced diabetes, renal failure, so many others. It really, really matters. And when they tell you that people should just get a job, right, I just want to tell you that all the people we serve don't fit that. In fact, many of them had jobs. They lost their jobs because of illness. They became poor. They all have pre-existing conditions, which would make them ineligible pre-ACA for insurance. And so a lot of the rhetoric that you're hearing just doesn't fit. It's not true. And we must all together urge our senators, no matter whether you're from a great state or you're not. I happen to be from a great state. I'm very lucky. But we have to urge all of our senators to vote against this Senate bill because it will hurt people living with HIV and with all severe illness. And we just can't stand for that. Thank you very much.
Next, we have Lee Starrow from North Carolina AIDS Action Network.
Well, I am from the great state of North Carolina. Do we have any North Carolina fans in the house? Woo! So I am stunned and surprised to be here today. I did not, when I set out over the course of this year, think that it would take this long to repeal the Affordable Care Act. I thought it was done, set. We had promises that this would happen in January, and I think that this opposition is strong and mobile and continue to ready to be in the fight. Woo! The North Carolina AIDS Action Network is our statewide organization in North Carolina, representing the 36,300 people living with HIV. It is no secret that gutting the Affordable Care Act would be devastating both to our prevention and our treatment efforts. Others will make the case better than I will, but if I could leave you with one thing, I think that it is not an exaggeration and it is not hyperbole to say that people will die in North Carolina, New York, and all other 48 states if we gut and repeal the Affordable Care Act. It is inexcusable that we are having this debate about a bill that would cut 22 million people off health insurance. So I want to talk about what we are doing in North Carolina to keep this fight going. And I want to give a shout out to my partners down in the Old North State. At the start of this year, we created a coalition called the North Carolina Health Action Coalition. And with partners like the North Carolina Justice Center, NARAL North Carolina, Planned Parenthood, Equality North Carolina, the North Carolina Community Health Center Association, we have been mobile and active this entire year to put pressure on our delegation to make sure that we save the Affordable Care Act. Now, I'm going to admit something. We dropped the ball on the House vote a couple months ago. We got complacent. We thought we had succeeded. We were proud of our work. We celebrated when that first vote was pulled. We cannot get complacent again, and we are not going to get complacent again. Since the start of this month, we have been hosting weekly phone banks every night to get our members from all of those organizations to directly call into Senate offices and say, do not repeal the Affordable Care Act. Just today, we held press conferences in Charlotte, in High Point, in Raleigh, North Carolina, and if anybody's watching on the Facebook live stream in Greenville, North Carolina, and rural eastern North Carolina, there will be a press conference tomorrow to continue speaking out about this devastating bill. In Charlotte tomorrow night, we are hosting a phone bank and a letter writing party. And if you live in the Triangle and Carborough, every single Thursday night, and we are not going to stop until we kill this, we will phone bank every single Thursday night until we kill the Affordable Care Act. Or we're not so we can kill the Affordable Care Act, sorry. I think it's not a secret that it was probably strategic to name the American Health Care Act something so similar to the Affordable Care Act. So we are going to continue this fight, and we're not going to stop. I want to leave you with one thing. So our coalition decided several weeks ago that we had to bring some life and we had to bring some energy to this campaign, that we had to have fun with this, that we had to celebrate this work even in the face of opposition. We took on the age-old phrase, I believe that we will win. We start every meeting with I believe that we will win. We end every meeting with I believe we will win. I've sent emails with subject lines that I believe we will win over and over. And I want us as a group to chant. Will you chant with me? I believe that we will win.
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 Thank y'all so much, and let's make sure that we kill, repeal, and that we save the Affordable Care Act.
All right. You know, in 30 plus years of an epidemic, one thing that my strong community has learned is how to be adaptable and how to give a good speech. So we have about 20 minutes left and a whole lot of speakers. So I'm going to ask that our speakers quickly move through your moment, about a minute or less, if you can. Next up is going to be Benton Jones from the National Black Justice Coalition.
Good afternoon, everyone. Oh, we can do better than that. Good afternoon, everyone. All right. My name is Benton Jones, and I'm with the National Black Justice Coalition, a civil rights and social justice organization dedicated to the empowerment of Black lesbian, gay, bisexual, transgender, and queer people, including people living with HIV. I also serve as a board member of AIDS United and someone who has been living with HIV for 10 years undetectable because of the ACA. Thank you to the organizers for bringing us together to fight for something that is important to us all, and that's health care, and ensuring that every American, no matter their race, sexual orientation or identity, economic status, or pre-existing health condition has equitable access to the life-saving health care provided by the ACA. We all know what will happen if the Better Care Reconciliation Act is passed. The Better Care Reconciliation Act is passed. Millions, about 22 million to be exact, will lose their access to health care. The Republican-led plan to repeal and replace the ACA is simply a plan to strip access to health care from people living with HIV, low-income people, the elderly, and other vulnerable populations in our nation. As an organization who represents some of the most impacted in the HIV/AIDS epidemic, Black gay men, Black transgender women, and other Black communities and LGBT communities, we cannot and will not sit in silence and allow this bill to come to pass. Just when we are at a point where HIV among black women has fallen 42% between 2005 and 2014, and finally seeing a stabilization of new diagnoses among black gay men, we cannot rest until we get to zero, and this will not happen if this bill passes. So we all have an uphill battle. Well, I guess to say an uphill battle is an understatement if this bill is passed. And in the words of Dr. Martin Luther King, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. Thank you to everyone for your fierce advocacy and dedication in ensuring that healthcare remains for all. And so I will leave you with this. What do we do when healthcare is under attack? What do we do when healthcare is under attack? What do we do when healthcare is under attack? Kill this bill. Thank you very much.
Thank you, Benton. You know, in March of 2004, I was diagnosed with HIV, and an organization like many of the ones that my colleagues work at helped to save my life. Next up, the president and CEO of Equitas Health.
We had been talking about reductions of X% and Y% and so forth in the emissions from these harmful pollutants from primarily coal-fired utilities. And at the end of the conversation was about to finish up, this one older fellow representing a utility down in the southern part of our country. And he's sort of a curmudgeon-like person. And he said, Senator, he said, this is what you need to do with respect to the restraint on emissions, reduction of emissions. That he said, here's what you need to do. You need to tell us what the rules are going to be. You need to provide us some certainty and predictability and give us a reasonable amount of time to comply and then get out of the way. I will never forget that conversation. Tell us what the rules are going to be, provide us some certainty and predictability, reasonable amount of time, and get out of the way. And it's not just utilities that want some certainty and predictability, but so do others. And particularly as utilities are a regulated industry, so is insurance. And they do like to have predictable and certainty. And if I were in their shoes, I probably would as well. What happened is we assured when we passed the Affordable Care Act, and it's always helpful to remind everybody that we tend to focus just on the exchanges, the marketplaces, and the 50 states which provide health insurance for maybe 5, 6, 7% of Americans who get their health care coverage. Most people get their health care coverage from the employer-provided programs. Maybe 20, 25% get their coverage through Medicaid. I used to think Medicaid was health care for poor women and children. And I don't know when Senator Cardin was the Speaker of the House in the Maryland General Assembly, but when I was elected state treasurer, I used to think Medicaid is for health care for poor women and children, not much else. And as it turns out, it's a lot more than that today. But 20, 25% of the folks get their coverage there. Another 15% or so in Medicaid, another 15% or so in Medicare. And the rest is in the exchanges. Every state has an exchange. And the amount of, that's for folks who can't get coverage anywhere else. And then the idea is to have some opportunity to participate in a purchasing pool. We made a promise when we passed the Affordable Care Act that we would do the kinds of things that Senator Cardin is talking about to provide certainty and predictability for the health insurance companies when they insure in these exchanges. The health insurance companies were reluctant to provide coverage to the folks that were going to get coverage through the exchanges. And as my friend will recall, some of these people hadn't had health care for months, years, maybe even decades, in some cases maybe never really in their lives. And so nobody really knew how much health care they would need, except we knew, and the insurance companies knew, these people would need a lot. They would need a lot. And as my friend has said here already, we provided some ways of reducing that uncertainty, reducing the lack of predictability. And then it's like the comic strip Peanuts with Lucy and Charlie Brown in the football. When she pulls the football away and always fools him. Always he still kicks and misses every time. And we sort of did that with the insurance companies. We assured them that we would help them provide some stability in exchanges, and then we took away the very mechanism that was designed to do that. And I think what my friend is saying is we need to come back and provide assurance. There's maybe 3 ways to do it, and I'll stop. One, with respect to reinsurance. 2, the risk, the assurance of the covering the costs, the risk costs. And the third is to do something. If we don't continue with the individual mandate, we need to come up with something that's very much like the individual mandate, that is not as harmful as what our Republicans are suggesting, the 6-month lockout. I just don't think that's humane. So, yes,
would my friend yield for a question?
I'm happy to.
My friend, as a governor, really has helped to educate me over the years on this whole question of the states being the laboratories of democracy and trying fresh approaches, and Delaware has done that, and Oregon has done that. I asked my friend, as a former governor, what would it mean to you if you were staring at a 20 or 25% reduction in Medicaid? Because, as you know, that's what's contemplated with the Senate Republicans.
I was governor from 1993 to 2001. Started in a recession, ended up with 6, 7 really strong years, as you'll recall, the Clinton administration. And we were able to balance our budgets 8 years in a row, cut taxes 7 out of 8, pay down some debt, got AAA credit ratings across the board. And so those are good days. The person who was my Secretary of Finance for the last 4 years is now our governor. John Carney. And Ben knows him, I think, pretty well. And a wonderful member of our Congress, wonderful lieutenant governor before that. But he's looking at in a budget of less than $4 billion, he's looking at a $400 million hole to fill. And if what's being proposed by our Republican colleagues on Medicaid, it would not make that $400 million hole any smaller. It would add anywhere from $100 to $200 million, increase it anywhere from 25 to 50%. It is a killer. And our governor and our legislature are struggling enough to try to fill a $400 million hole rather than trying to figure out how to deal with something $500 to $600 million. It would be a backbreaker. That's what we're looking at. And so I share that with everybody. Go back to laboratories of democracy. Some people would like to have like Medicare for all, or one of our colleagues, several of our colleagues are very, very much interested in a single payer system. As an old governor, someone I had the privilege of leading the National Governors Association and then heading up the National Governors Association Center for Best Practices. I'm a believer that the states can be that laboratory of democracy. And they can show us, take ideas and show that they're good ideas for the country and other states, or they can take ideas and prove that they're a bad idea. And we ought to enable them to do that.
I thank my friend. Would my friend like to add anything else, or should we yield to Senator Cantwell?
I just want to say a kind word about our presiding officer. Say that, and he's heard me say this before, I'd say it again. But he may recall having co-sponsored legislation in '93 offered by John Chafee and co-sponsored by Orrin Hatch and others that actually had a lot of good ideas in it. The idea of establishing exchanges in all 50 states and having a sliding scale tax credit that brought down the cost of health insurance. And the lower the income of the people in the exchanges, the bigger the tax credit. They had the individual mandate in there so to make sure that young, healthy people got coverage too. And we didn't end up leaving the health insurance coverage just a pool of really unhealthy people to try to insure. And they had an employer mandate that said employers, a certain number of employees had to participate, and there was a prohibition against insurance companies denying coverage. I just want to say that our Republican friends who took that idea, and Mitt Romney used that idea to establish Romneycare when he was governor of Massachusetts. It worked there. Not perfect. It took a while, but it worked. And I would just say we shouldn't give up on that idea. We should not give up on that idea. And there are ways that we can fix it. Senator Cardin has talked about some of those ways, and I'm sure Senator Wyden as well. We should, and I'd stop with this. I just heard John Kasich on one of the interviews, one of the shows on TV, and he said these words. He was with Governor Hickenlooper, and he said that the fellow moderating the show, he said, "We got to stop just being Democrats on this or just being Republicans on this. Folks want us to be Americans on this and to work together." And that's, I think, what I'd like to do, and I think we can do that in a way that brings credit not just to our parties, but really to our country, and accomplishes the 3 things that the president has talked about for a while: coverage for everybody, better quality coverage for less money. And there's no way Democrats by themselves or Republicans by themselves are going to do that. But if we work together, all things are possible.
Before Senator Cardin leaves the floor and we yield to our friend from Washington, who also is so knowledgeable about health. I just, on this point of the states being the laboratory of democracy, during the debate, as my colleagues will recall, on the Affordable Care Act, we wrote a provision, 1332, that gives the states the authority to do better, to come up with, as Senator Cardin has said, as the distinguished senator from Delaware said, Senator Carper, it's a chance to do better and to try out those fresh ideas like my colleague has been saying. The problem is with the Senate Republican bill, they're talking about giving the states the right to do worse, to waive out of some of these essential protections. So again, I think this is a natural for something that could be bipartisan, where Democrats and Republicans could work together to really encourage states to do better. But let's not go the other way and abuse that provision in the Affordable Care Act so that states do worse. And I thank my colleague. Senator from Washington.
Mr. President, I join my colleagues here from the Finance Committee, and although I don't want to admit it, it was 10 years ago that we had this discussion in the Finance Committee, my colleague from Maryland and from Delaware and from Oregon. And I think what people don't realize, even the president knows, that we spent a lot of time talking about health care. This was not a let's have a few meetings and roll out a bill. There was a very, very long period. In fact, the president knows that our side got a lot of heat for a lot of dialogue that happened with him, and our colleague from Maine at the time, a lot of heat for dialogue with her. And but I think there was a period of time, about 6 or 7 months, where every single day I went to at least one thing in the discussion of the healthcare policy. At least one thing every day for like 6 months. And that wasn't even the markup, that wasn't even the meetings, that was just a time period where the committee had designated various subgroups that we would talk about policy. I don't know if the two of you remember that period, but my recollection is every single day I was going to something regarding the healthcare policy and listening to experts and recommendations. And then, of course, we had these, I call them more roundtables than hearings. We had a lot of roundtable discussions. And then we obviously went through a very, very formal bill process. So there is a little bit of irony that we're the ones out here today still talking about this healthcare bill, I think because we know what the challenges were, and we tried to address them, and we're not afraid to keep addressing them. We're not afraid to be out here today talking about solutions that we want to see as well. So I thank my colleague from Delaware, my colleague from Oregon, for both being part of that effort, because it really was an unbelievable amount of time and energy and discussion and formulation. And the notion that somehow now we would take something that's 1/6 or 1/7 of the economy and draft something up in a dark process and then throw it out here. I'm not surprised today that there aren't the votes, but the thing to do now is not try to just rake up some votes in the next few days and then come back in July. The thing is to sit down and have a serious discussion. I noticed that a couple of my colleagues are down at the White House, and they're positioned right there next to the president. Maybe they're trying to make them on the hot seat, and he's sitting there talking about the individual market. He's talking about the individual market in Alaska. And all I'm thinking is the individual market in Alaska, we're sitting here, the other side is proposing to cut 22 million people off of Medicaid. What does that have to do with the individual market? Nothing. So I don't know if people are ready to focus on this the way we focused on it, in that time period for more than a year, day after day after day, or day after meeting and hearings. But I would hope that what they would do is stop this proposal and sit down and have an open process and have the discussion on these policies, because they're so important. Now, we've been having all this discussion, and a lot of the frustration that people have talked about is the 7% individual market. And there are ways to fix and improve the individual market. I feel like I was fortunate enough to put forward one of the better ideas that has worked successfully, at least it's working successfully in the state of New York, the basic health plan. 650,000 people are on the basic health plan as a proposal. I think they call it in that state essential care, that you can buy a premium for $500 on an annual basis instead of the $1,500 on the exchange for that population that is above the Medicaid rate that needed to have a solution in the marketplace. There's 13 different people offering insurance to those 650 people. So that's obviously working. It's working. Now, it got implemented late. New York did it in 2016 because they were off to the races, but other states should now consider this. What's so great about this and helping to address the individual market is because where we are on this side, we are willing to allow individuals that don't work for a large company to get the same clout as if they worked for a large company. Because when you buy in bulk, you get a discount. Americans know that. That's why they shop at Costco, because if you go there and you buy in bulk, you get a discount. Well, that's what they're doing in New York. 650,000 people have been bundled up like they're a big company, and they're saying to the marketplace, who wants to bid on selling us insurance? And the end result has been more affordable insurance in the individual market. That's what they should be discussing down at the White House today. That's what they should be discussing, not cutting 22 million people off of Medicaid. That is not a smart idea. And I'm sure my colleagues here have already gone over this notion that once you cut people off of care, they just end up in the emergency rooms or exacerbated health care needs. So longer periods of time to get access to health care, more complicated health care costs, rising premiums. When we've gone around our state, heard loud and clear from the provider community, the hospitals, that they saw downward pressure on price of private insurance because we expanded Medicaid. And the economic numbers are out there now to show the same thing. So cutting people off of Medicaid is not the solution to the individual market. I hope somebody down there at the White House brings that up. In 2020, when the Medicaid cap, if it did go into effect, the analysis is that it would cost SHIP $324 million per year to my state. They would be cutting people off of the Medicaid, and then basically the cost would be $324 million a year to our state. So you can imagine that our state doesn't have that money and isn't interested in picking up that tab. And by 2028, we would be cost shifting $4.2 billion. So not something that is smart economics for us. And I just, over the weekend visited Virginia Mason Hospital in the Northwest. Again, great success in delivery system reform. They've kind of implemented the Toyota model of production. So literally, faster turnaround time on lab reports, better expedience of nursing care. I think it was something like 72% reduction in insurance liability. I mean, huge successes by changing and improving the delivery system that helps put pressure down on price. This is what we need to be talking about. And there is much innovation that was in the Affordable Care Act. And we need to now ask the question, what further things do we need to do to make sure that that kind of driving down cost is there in the individual market as well? But you are not going to drive down price. There are reports now out by the Center on Budget Priorities last Friday that shows that the price will actually go up in the individual market if you cut people off of Medicaid. Basically, it will just increase by several $1,000s the actual amount of money that the individual market will have to pay in insurance. So that clearly is not the solution. I urge my colleagues on the other side of the aisle, I hope they come back and say it's time to work in a discussion about these ideas in a broad way, not just another Hail Mary pass. Just get rid of this notion that cutting poor people off of Medicaid is somehow going to magically fix the individual market. It's not. And so I just thank my colleagues from the Finance Committee who went through all of that. And believe me, I'm telling you, these discussions went on for weeks and weeks and weeks. Some people here are trying to come up with a score and get an answer in a week on this entire package. I think we probably debated for I would say probably 2 or 3 weeks just on the notion of reforming the getting off of fee-for-service and focusing on a value index and getting the priorities of the delivery system focused on better outcomes at lower cost. This is something that really should be a big priority in healthcare. And I remember we had private meetings, we had the head of CBO come down and talk to us, we had hearings. We probably spent 3 weeks just on one concept of how effective that would be in the healthcare delivery system. So I just, I see we're still here, we're still talking, we're still willing to improve this delivery system and make sure people have better access to care. And I thank my colleagues for including me in this discussion today. And I see my, I just want to again thank my colleague from Oregon, the ranking Democrat on the Finance Committee. I know he knows exactly what I'm talking about when we talk about innovation. There's so much innovation that he put into the Affordable Care Act, giving states the discretion. They already have all the discretion they need. They have all the discretion they need to keep innovating. And hopefully we will get our colleagues to follow suit, because this is where we're going to deliver better care at lower cost and help improve the access for everybody in America. So I thank my colleague.
I thank my friend from Washington State who was for care coordination, moving away from fee-for-service, using bargaining power, locally driven approaches, long before it really became a buzzword in American healthcare, and I thank her very much for this.
From Oregon, just to yield for about 30 seconds.
Of course.
Something that the senator from Washington said just reminds. I was after we heard the news that Republicans are basically going to go back to the drawing board and see what they could come up with maybe during the July 4th recess. I did a radio interview with the station back in Delaware. One of the questions that the interview asked me, he said, well, the Republicans have a lot of money to play with. He said, I hear $200 billion, and won't the Republican leaders just like offer money to one senator after the other to find out what they need in order to really get them to support this? And I said, I hope not. I hope that's not what happens. That what we need, this is a time when we need to hit that pause button, and rather than dole out money to try to draw this Republican or that Republican to come into the fold, if you will, why don't we just spend some time in those, like the rooms that Senator from Washington is talking about? We spent all that time, a lot of time together with Democrats and Republicans in hearings, public hearings and private meetings and so forth, roundtables. That's the kind of thing we need to do over again. If we do that, we might be surprised. We might surprise the rest of the country by how well that would work out. Thank you.
I thank my colleague, Senator Warner.
Mr. President, let me join my colleagues on the Senate Finance Committee and both express my concern about how we got here, but also acknowledge that an awful lot of folks in Virginia, and I'd argue some folks in North Carolina, and folks across the country breathed a little bit of a sigh of relief today. But all that sigh of relief was just the fact that we have a bit of a reprieve from a proposal that in my years here, I don't think I've ever seen.
Senator from Virginia will suspend for a minute. If we're going to carry on a colloquy, the senator from Oregon has to remain standing.
I thank the president, and at this point, we're just going to hear from Senator Warner.
Mr. President?
Chair recognizes Senator from Virginia.
Thank you, Mr. President. Again, here joining my colleagues from Democratic colleagues from the Senate Finance Committee, and believe that folks in Virginia, and for that matter, folks across the country, got a reprieve today when the majority leader indicated that we were not going to vote on the piece of legislation that he brought forward, a piece of legislation that has been acknowledged by the CBO that would take 22 million Americans off of health care, would transfer 700 to 800 billion, depending on the estimate of costs from currently borne jointly by both the federal and state partnership in Medicaid, thrust that cost upon the governor of North Carolina, the governor of Virginia, and a host of others. And a proposal that I can't recall in my time here in the Senate that has been as universally panned by organizations from the left, right, center, and everywhere in between. And as perhaps the president is now acknowledging with the majority leader and a number of other Republican senators, that using his own quote that nobody knew health care was so complicated. Well, the fact is, the vast majority of members on both sides of the aisle have realized health care is extraordinarily complicated. It's why it took years to fashion the ACA, and why there are many of us, again, on this side of the aisle, that would continue to say, we acknowledge years after implementation of the ACA, there are many things that need to be fixed. But the only way they're going to be fixed is if we do it in a bipartisan fashion. Instead, the legislation that we were going to vote on tomorrow would have actually made health care much more expensive, less affordable, and less accessible for a whole wide breadth of Americans. Don't take my word for it. Don't take these other elected officials' word for it. Let's look at well-respected bipartisan groups. The American Cancer Society said that the bill that was Majority Leader put forward would be devastating for cancer patients and survivors. The American Medical Association said the Majority Leader's proposal violates the very first dictate of the Hippocratic Oath, which said, do no harm. Obviously, this bill would have done a great deal of harm. The American Academy of Pediatrics says the bill fails our children. The National Center on Addiction and Substance Abuse says the Republican proposal will crush efforts to end the opioid epidemic. And the AARP says the proposal would leave millions, including our most vulnerable seniors, at risk of losing the care they need. But it's not just these leading healthcare organizations who've come out uniformly and virtually universally against what the Majority Leader had proposed. I'm also hearing that from Virginians. Monday of this week, I attended an opening of the new PACE program in Fairfax, Virginia. The PACE program, which I know